Welcome to this week's new video update for FHN. I want to thank you for once again spending a few minutes with us to learn about all of the happenings that are occurring at FHN and how we continue to be committed to serving you, our community. Joining me today is Dr. James Kolka. Dr. Kolka is our Chief Physician Executive and is also an emergency room physician, so he knows firsthand about when you should come and be talking to your physician sooner rather than later. So it's my pleasure to turn you over to the very capable hands of our Chief Physician Executive, Dr. Kolka.
This is something that worries me as a physician, and particularly as a Chief Physician Executive for FHN a lot. We have seen a dramatic decrease in the volume of patients that are visiting our clinics, and in half our emergency department volumes have been essentially cut in half. We know this is causing us problems. I think we have some discussion that we're going to talk about later, that I can outline that a little bit more. The point I would like to make is that because we have COVID-19, we, FHN, are open and we are safe, and those individuals who especially have chronic illnesses like asthma, diabetes, heart disease, hypertension, they need to see their physicians on the regularly scheduled basis. We, of course, did discourage early those individuals coming in for less than urgent conditions like sports physicals, school physicals, because we were trying to comply with the stay-at-home order. But now, as this stretches on, and we're in the third month beginning, we know that many of these individuals really do need to see their physician to keep their health care needs up to date. So in the emergency room, we're still seeing the typical array of individuals. However, the amount of people we're seeing has literally been cut in half, and that's not new or unique to us. That is something that is nationwide. In fact, there was an article written by the president of the American College of Emergency Physicians who said, even though the volumes are cut in half, the amount of people having heart attacks is not cut in half. And we have actually found that to be true here. When we have a partnership and affiliation with our cardiology program with Swedish American Hospital in Rockford, and we were discussing that fact one day, that we found out that they literally had almost no cardiac heart attacks within 1 week. So we went back and we began to look at the types of individuals that we have seen coming into the emergency department. That in the last 4 weeks, we found out we had more people that came by ambulance in cardiopulmonary arrest with CPR being performed than we had in the 3 months prior to COVID, which means to me that individuals are either afraid or something's causing them to not want to come to our emergency department. This is a really, really critical question. Those individuals who have signs and symptoms that could be or are serious need to know, we're safe, we're a safe place, we provide care. If you need care and you have symptoms that are critical, you really need to go to the emergency department. Beyond what I just talked about, which I am very worried about, people not seeking care for acute emergencies, we know that people are not seeking care in the clinics. Our clinic volumes have averaged 25 to 30% of normal. Now, we know there's a subset of people out there that have diabetes, heart disease, lung disease, those type of issues. These require monitoring by your physician to keep you healthy. We want you to see your physician. You have options. You can call and make an appointment with your physician. We now do telehealth visits. Telehealth visits, if you're feeling perfectly fine and you're diabetic, your blood sugars are doing fine, schedule a telehealth visit. If your blood sugars are out of control, your blood pressure is seemingly out of control, it's probably better that you make an appointment to see your physician. So again, I really want to stress that we believe our clinics are safe. We're practicing safe social distancing. safe practices in terms of masking, hand washing, and again, it's not worth letting your health suffer when we know we can provide you good, safe patient care. Well, again, I would stress, if you're having anything that is concerning, chest pain, shortness of breath, severe abdominal pain, severe headaches, high fevers, things that would typically tend to worry you as an individual, I say go to the emergency department. If it's your chronic disease, your blood sugar is getting a little bit out of control, your blood pressure is getting a little high, you need to interface with your primary care physician. Sometimes they'll be able to help direct you. There will be occasions where you'll call your primary care physician. The first words out of their mouth will be, call 911. That may be a life-saving call that you made. So it's an individual decision, but it's something that, I think most people are able to manage. Anytime, if you're over 40 or you have a family history or a personal history of cardiac disease, then you're having chest pain that is different or unique, you need to call 911. If you're having very, very significant shortness of breath, shortness of breath can be a lot of things, but 50% of all heart attacks don't have chest pain. They only have shortness of breath. It could be asthma. Shortness of breath could be COVID. And when it starts to affect the lungs, that's a real emergency. Severe abdominal pain, that's always an emergency, especially as you become over 40 or 50, it becomes a much different disease. Anything where you have severe pain or symptoms that just seem to be worrisome, no one's going to be mad at you for calling 911. But, the consequence of not calling 911 can be fatal. And I will give you just a short example. My uncle, who was a dentist, a healthcare professional, started to have chest pain. Instead of calling 911, he called his best friend, who was a cardiologist, who said, come on over to my house, I'll see you, and we go to the hospital. Well, he never made it to the hospital. He died on the way. So there's some things you just gotta, you really need to put in the hands of 911 and the emergency department. I'm not advocating that you go into to the emergency department or call 911 for a stuffy nose or a sore throat. It's symptoms that bother you. It's symptoms that seem different. It's symptoms that seem out of control. But again, chest pain, shortness of breath, severe pain of any kind, those are the kind of things you want to call 911. Or if you're really worried, call your doctor and ask him where you should go.
Some of the things that have changed at FHN is our excitement about being able to take care of so many families throughout our community. So we've been able to resume elective procedures, and we've also been able to expand some of the other offerings that we have from a service standpoint. So we are encouraging people not to delay in putting off their care and coming in to visit with us. It's of critical importance that we keep both our patients and our staff very safe as we're starting to resume a lot of these procedures and see more appointments coming through our doors. So we've taken a number of precautions, which include social distancing. It's included very extensive cleaning protocols, as well as making sure that we keep people the safest way possible by limiting their exposure and the number of folks that are moving back and forth through our halls. So we've kind of staggered out the time that people are arriving and also setting up separate waiting areas and putting in different protocols to make sure that everybody is safe. So IDPH, the Illinois Department of Public Health, has allowed us to do any procedures that our physicians and patients feel necessary. I think it's a misnomer when we say elective. Many times people are not excited about having to have any procedures done, but they're doing it for a specific need, and that's to enhance their quality of life. And so what we want to do is to make sure that we're able to offer any procedures that will help enhance people's quality of life and that are medically required or necessary. So some different things as people come into the hospital is that we are still limiting our visitor restrictions. So we want to make sure that we're keeping people safe, but we're also testing patients that are coming in for surgical procedures for COVID-19. And this is for awareness so that the patient is aware and also our staff are aware. Once again, as a precautionary measure, we want to make sure that we're keeping everybody safe from COVID-19, which requires some additional screening. So that'll be something new from what we've done in the past when people are attending surgical procedures or some other invasive procedures. Another measure that we've taken to keep our community safe is modifying our emergency room processes. So during the day, individuals will be greeted at the parking lot by a nurse who will do a basic screening to see if there are COVID-19 related symptoms, in which case that person or persons would be redirected to our COVID-19 aid tent for the appropriate screening, testing, and treatment if necessary. Otherwise, if it is an emergent concern, they'll be directed to the emergency room. After hours, we still have changed the way that people are greeted, and what we're trying to do is to create some separation of patients that may have COVID-19 related symptoms and other patients. In all instances, we want to make sure we're creating some separation from people that don't know each other to minimize any contamination or spread. I think what makes FHN very special is always it's about the people. And we've been serving people since 1902, and those people are local. It's our communities. Our organization has maintained a local focus on the communities that we serve as part of our core mission. And we do that because the people working here are also the people that are living throughout our communities. And we take it very serious because we're caring for one another's families. We also want to make sure that we are supporting our local economy and keeping our decision-making focused on this community. We have a local board of directors, and we are an independent hospital and health system so that we're able to make some decisions that don't always make the best business sense at times, but are the right decisions to help us serve our community needs. At FHN, we're very grateful for the roles that we play throughout our community. But to thank our caregivers is not just a one time a year event. We want to do that on a regular basis, and we do receive a lot of recognition for all of the great work that's being done. Certainly this year with COVID-19, it's inhibited our ability to be able to do any large celebrations or big group gatherings, but we are still expressing gratitude, and it's just as important that we say thank you to each one of our caregivers for the work that they do. Each one of them remains committed to having purpose, doing worthwhile work, and more importantly, making a difference in the lives that we serve. So expressing that gratitude for our caregivers, for our community, and to each other shouldn't be just a one-time event, but this week we're spending a little bit of extra time just to make sure that everybody gets a thank you. A parting thought for the community is to stay safe, to make sure that we're still following proper hand hygiene, making sure that we're not touching our face, wearing our masks out in public as required, and also maintaining that social distancing. But at the same time, I'd like to ask the community to extend an act of kindness and make that connection with one another. It's even more important to ensure that people know that they care for each other, just like FHN cares for every member of our community, and we're here to support all of their needs. I would also ask community members to continue to support local businesses and make sure that we are all successful as we look to rebuild and reemerge as a stronger community from this experience.